In this video, we are going to cover multiple topics. We're going to start by talking about strokes. So we'll discuss the different causes of them, treatments, and symptoms of strokes. And then we'll get into cerebral palsy and the different forms of that disorder. And then lastly, we are going to cover the different forms of epilepsy. So let's start with strokes. The medical term for strokes is a cerebrovascular accident, or CVA, and this is one of the abbreviations you will need to know for Chapter 9, so it should be on your abbreviation list. A stroke or a cerebrovascular accident is going to occur when the blood supply to a part of the brain is suddenly interrupted. And there are two ways that this can happen. So if you look at the picture on the slide, the first one is that there's a blockage of some sort in a blood vessel of the brain that cuts off blood flow. So that would be the right picture there where you see the blockage of what looks like plaque in one of the arteries of the brain. The other is bleeding in a blood vessel of the brain, which is going to prevent enough blood to get where it needs to go. So that would be the leftmost picture. You can see that there is some sort of a bleeding incident that's happening in a blood vessel of the brain, and then that is going to prevent all of that blood from getting where it needs to go. Either way, the reason this causes a stroke is because it is the blood supply to the brain is being suddenly interrupted. So if the blood is not getting to the brain in an efficient manner, that is depriving the brain cells of oxygen. And if brain cells are deprived of oxygen, it causes them to become damaged. And if treatment is not sought after in a timely manner, those brain cells can eventually die. And once brain cells die, you can't get them back. Okay, so strokes are very serious. There's two different types of strokes. The first is called ischemic strokes. Ischemia means a lack of blood supply to a tissue, and this is one of your words on your list. So ischemia is going to be a lack of blood supply to a tissue. So these are strokes that are caused by some sort of blockage in the blood supply to the brain. These kinds of strokes account for about 90% of all strokes, so they're very common, and they can be caused by various means. So we're going to talk about 3 of them, and each of these is a word on your word list. So the first is called arteriosclerosis. This is where there is a buildup of plaque in a cerebral artery, and if we look at cerebral, that is not one of your words, but know that that means brain. So this means that there is a buildup of plaque in an artery of the brain. This can obviously then block the blood supply, depriving the brain of oxygen and thus causing a stroke. The second cause is embolism. This is also, again, one of your words. And this is when there is an obstruction in a cerebral artery due to a substance that originated in another part of the body, like a blood clot. So let's say you had a blood clot somewhere in your leg, and part of that blood clot kind of released itself and traveled through the bloodstream, and it got lodged in one of your cerebral arteries. That would obviously then block the brain's blood supply, causing a stroke. So you didn't have a blood clot in your brain, but a part of a blood clot from somewhere else in your body landed in your brain. The third cause is called microangiopathy. That prefix micro means small. So this is when there is a blockage of some sort in the capillaries of the brain. And remember, capillaries are really tiny blood vessels, so that's where the micro comes in. And again, if there's a blockage in the capillaries, there's going to be brain cells that are deprived of oxygen, thus causing a stroke. Now there's only one way to treat ischemic strokes, and that is via thrombolysis, and this is one of your words as well. So when you go through thrombolysis, there we go, you are dissolving a clot, and the medical term for clot is a thrombus. So thrombolysis, the suffix lysis, is going to mean to destroy something. So thrombolysis is destroying a blood clot or a clot in general. Many times this occurs using what we call clot busters that are going to be introduced via IV. And this has to happen within 4.5 hours of the stroke. After 4.5 hours, if you do not get treatment, the damage to the brain could be too much to save, and it could potentially lead to death. The other type of stroke is called a hemorrhagic stroke, also known as intracranial hemorrhage. Hemorrhage is one of your words, and it means to bleed profusely. So a hemorrhagic stroke is when a blood vessel in the brain bursts or a cerebral aneurysm ruptures. Aneurysm is also one of your words, and that is an excessive enlargement of an artery caused by the weakening of the artery wall. So if you look at the bottom picture on this slide, you see a normal blood vessel, and then you see to the right of that same blood vessel with an aneurysm. So an aneurysm is just where the blood vessel is starting to bulge because it is getting really weak. The walls are getting weak, so it's causing the pressure of the blood flowing through is causing it to expand, and eventually if that were to rupture, like in the top picture of the hemorrhagic stroke, it would cause bleeding in the brain, which would be the other option to having a stroke. So if there's bleeding in the brain, obviously not enough blood is getting to brain cells, which is going to deprive them of oxygen and cause them to die. Since individuals who are having a stroke have a certain amount of time to seek treatment, again, it's 4.5 hours maximum, it is important to know yourselves how to determine if someone is having a stroke so you can get them to treatment in a timely manner. Medical personnel use the acronym FAST, and each letter stands for a different symptom except for the last one. So the F in FAST stands for face. So if you ask the person you suspect of having a stroke to smile, and one side of their face seems to be drooping, like in the picture, they could possibly be having a stroke. The A stands for arms. So if you ask the person to raise both of their arms either in front of them or to the sides, and one arm drifts downward, like they're having issues bringing it up, they could also then be having a stroke. It's another sign. The S stands for speech, so you can ask the person to repeat a simple sentence like, the sky is blue. If their speech is slurred or strange sounding, again, they could be having a stroke. And the T, this is not a symptom, but it stands for time. If any of the previous signs are present, you need to call 911 immediately so that they can undergo treatment within that 4.5 hour time period before their brain cells could be beyond saving. So remember those, remember this acronym, remember the symptoms, you could maybe save a life. Now, it's possible for a stroke victim to have a disability after their stroke, and we use the term ictal, which is one of your words, to describe a condition caused by a stroke or epilepsy, which we'll get to later. So a common ictal disability is a complete paralysis, meaning you cannot move it, of one side of your body. This is called hemiplegia and is also one of your words. So if you look at that word, that root hemi means half. So hemiplegia is going to be where you have complete paralysis of one side of your body. You are unable to move either the left or right side of your body completely. You are paralyzed. And the way that the brain works, if you have a stroke on the right side of your brain, it is going to impact the left side of your body. And then likewise, if you have a stroke in the left side of your brain, it's going to impact the right side of your body. Another possibility is that one side of the body is going to become weaker compared to the other, and that's called hemiparesis. And that's another one of your words, so it's not full paralysis, but you do have weakness in one side of your body. So those are two of the options. Individuals may also suffer from problems with awareness, attention, learning, judgment, memory. Some of them have issues controlling their emotions after a stroke. So these are all considered to be ictal. So they happen after a stroke due to your stroke. The next disorder we're going to look at is called cerebral palsy, and this is also known as CP, so that is one of the abbreviations that you need to know. And this is kind of an umbrella term used to describe the motor impairment that results from any sort of brain damage as an infant or young child. And it doesn't matter the cause of brain damage as long as there's some sort of motor impairment, meaning they have issues moving some part of their body because of the brain damage. We refer to it as cerebral palsy. And the term cerebral obviously refers to the brain, and the term palsy, which is one of your words by itself, means paralysis. And again, paralysis means that you can't move a part of your body, you are paralyzed. So cerebral palsy is not hereditary, it's not genetic, but the congenital form, meaning you are born with CP, can be caused by brain malformations in the womb. So while your nervous system is developing, there might be some sort of an abnormality in the development of your brain or your spinal cord. Or if the mother uses cocaine while pregnant, that can lead to abnormalities in the brain of the fetus. So CP, then in the neonatal period, so that means that it's developed at birth, like during birth, is usually due to some sort of an accident or an incident that causes hypoxia of the brain. So hypoxia is, again, one of your words, and it means a lack of oxygen in cells or tissues. So for instance, if the baby comes out and the umbilical cord is wrapped around their neck for too long, it could cause brain damage, which could lead to CP. And obviously this is all going to cause a delay in the child's development because of that brain damage. Now, there are many classifications of CP, which are determined by the number of limbs that are impaired. So remember, palsy means paralysis, so there is some sort of paralysis in a number of limbs, and you're basically classified on how many are impacted. So all of these words are on your list. You'll notice that they all have different prefixes, but they have the same root. So let's start with quadriplegia. This means that all four limbs are paralyzed. So that prefix quad means four, so all four limbs are paralyzed. Diplegia means that all four limbs are involved, but two of the limbs, usually their legs, are affected more severely. So you might have motor impairments in all four limbs, but most likely your legs are going to be fully paralyzed. And again, that di means two. So you have to remember that all four limbs are involved, but two of the limbs are fully paralyzed. Hemiplegia, we've already talked about, would be an arm and a leg on one side of your body, so like your left arm and your left leg. Monoplegia, that prefix mono means one, so this means that there is one limb affected, and it's usually an arm. The next one is paraplegia, that is paralysis of both legs. And then triplegia is paralysis in 3 of the 4 limbs. So the difference, you might be asking between diplegia and paraplegia, because obviously it affects both legs, both of those. Diplegia, actually you have some weakness in your arms as well. Paraplegia is just your legs. We can also classify CP patients by their movement disorder. So there are 3 classifications under this category, and none of these are on your word list. So the first one is spastic movement disorders. These occur in CP patients that have naturally tight muscles that are very resistant to being stretched. And so when the muscles are used, they can become very overactive and produce repetitive movements. The second is athetoid movement disorders, and these cause individuals to have difficulty controlling and coordinating their muscle movement, which then leads to involuntary writhing movements in constant motion. And the last one is an ataxic movement disorder, which involves having a poor sense of balance and depth perception, which can lead to a staggering walk and unsteady hands. A lot of the times you might see ataxic CP patients with walkers because they do deal with a poor sense of balance. Medical professionals sometimes combine the different classifications together to better describe a CP patient. So for instance, we could pull a word from the last slide and from this slide to better understand what a patient, the impairments of a patient. So for instance, we could describe an individual with CP as spastic diplegia, which means that they have tight muscles in all 4 limbs, but more so their legs. Epilepsy is the last disorder we're talking about in this video, and this is a disorder in which clusters of neurons in the brain discharge their electrical signals in an abnormal rhythm, causing seizures. And sometimes it can lead to a loss of consciousness. I believe LOC is one of your abbreviations that stands for loss of consciousness. Epilepsy is caused by many different things. It can be caused by abnormal brain development, or it can be caused by some sort of brain damage. And just like with cerebral palsy, there are various classifications of seizures. And we're going to talk about each one. So the first is called partial seizures, and this type of seizure happens when the neurons in a single area of your brain begin firing abnormally. So this type of neural activity usually doesn't cause a full-blown seizure, but instead causes a series of involuntary jerking movements of an arm or a leg. Okay, so it's very specific. It's in a very specific part of your brain. It only affects that part, and then it's just like a jerking movement, so it's not really dangerous to the person per se. The other classification is called generalized seizures, and that means that a larger majority of the brain has abnormal firing of neurons instead of just a select area. And there are 3 types of seizures that fall under this generalized seizure classification. The first is called absence seizures. These seizures begin usually between the ages of 5 to 10 years old and either stop at puberty or they continue on into adulthood. When a child is having an absence seizure, they begin staring vacantly for a few seconds. It kind of looks like they're daydreaming, like you can see in that picture. And then a few seconds later, they just come back to after the seizure is done. The second type of generalized seizure is called a tonic-clonic seizure. This is when an individual is going through or they experience a loss of consciousness. So again, that LOC stands for loss of consciousness. They also have their breathing stop, and their eyes usually roll backward, and their jaw clenches. So you can see in this picture, you have that tonic phase. So that's where they lose consciousness. Their muscles start to tighten, their breathing could stop, and it usually lasts anywhere from 30 to 60 seconds. Then, after the tonic phase, we move into the clonic phase, in which the whole body starts to shake. And this seizure, or this part of the seizure usually lasts a couple of minutes, and then their consciousness returns. So the start is kind of the tonic phase, where they just kind of seize up and lose consciousness. They might fall to the floor at that point, and then the clonic phase, their whole body starts to shake. The last type of generalized seizure is called febrile seizures, and these are triggered by a fever in infants from 6 months to 5 years old. And very few of these individuals, like I've had a lot of students in the past tell me that they used to have seizures as a little kid, usually due to a fever. A lot of them end up not developing epilepsy. Last type of epilepsy I'm going to talk about in this video is called status epilepticus. This is when an individual's brain is in a state of persistent seizure for 30 minutes or more. This could mean either the person is having one continuous seizure for 30 minutes or more, or they could be having multiple seizures without regaining consciousness in between for 30 minutes or more. It's believed that only 5 minutes in this state is enough to damage neurons in the brain. So this type of seizure is extremely serious and involves medical interventions. A lot of the times, medical personnel would need to do some sort of maintenance of the airway to help with breathing, to help with circulation, and usually they would give the patient an IV of really specific medications to make it stop. After a seizure, or during the postictal state, an individual might experience diminished function in the brain where the misfiring took place. So postictal is one of your words, and it means occurring after a seizure. So we talked about ictal, which is some sort of a disability that comes from a stroke or from a seizure. Postictal really means like directly after a seizure. Most individuals with epilepsy respond to anti-epileptic medication, but some require brain surgery in order to make the seizures stop. Because I like to kind of train you guys in the common knowledge to help you hopefully maybe save a life in your everyday lives. If you ever experience an individual having a seizure, there are some first aid measures you should take. The first is to move things out of the way to prevent the seizing individual from getting injured. So I had heard a story from a friend that they were at work and one of their coworkers fell off of their chair and started to seize, and they didn't know what to do. But someone was like an EMT or something, and they decided to move all the chairs out of the way. You really need to give the person room to just seize. You're just going to let their body shake, but make sure that there's nothing they could possibly hit to harm themselves. As long as you move things out of the way, really, the person shouldn't get injured from the body movements that are taking place. Secondly, you shouldn't restrict their bodies. Again, you need to let their bodies just go through the seizure. And then when they come out of the seizure, you should put them in what we call the recovery position. That's what's shown in this slide. So you put them on their side, you kind of put one hand under their head, and especially if they're vomiting or have vomited during the seizure, you need to make sure that they're on their side so they don't choke on their vomit. And so that is the end of video lecture number 1.